like when we finish the interview and then you need to stare the camera. Yeah.
I didn't got that.
The camera and then we.
After we are talking about infections,
Yeah.
you finally stare at the camera.
Okay.
Okay, 1 second. Yes, sir. Oh, okay. The first question is, may I ask you to briefly introduce your company, German LDG Asia Limited, to all of us?
Yes, the LDG company was founded in 2001. LDG stands for Laboratories Dr. Ganser, which is my name. We started in producing dendritic cells 2 years after it was published by Ralf Steinmann, who the inventor of the dendritic cell therapy, and he got the Nobel Prize in 2015 for his work. Over the years, we treated now more than 4,500 patients, meaning thousands of treatments, which we have done so far, and expanded then by the time first in Europe, in Austria, Spain, then to Balkans region in Serbia, which is Belgrade Laboratories, and finally 3 years ago we founded in Shanghai the LDG Asia Pacific, together with Professor Lin Yang and Ms. Tan Furong in Shanghai, and met then 2 years ago Ms. Gigi and Ms. Heidi, who asked us whether we could see a possibility to start with a laboratory in Asia. And so the idea of founding the LDG Asia was born and is now very well proceeding. So far the LDG is present in nearly every continent. We are in South America, we are in Middle East, in Europe, and now in Asia.
So we got to the second question. Yeah, we all heard about the Lennox, right? Your very famous products. Could you introduce to us about the Lennox? And it can really predict the cancer, right? Maybe you can talk a little bit more about which kind of cancer that this kind of medicines can treat.
Well, Lennox disease is an abbreviation standing for long antigen exposition dendritic cells, which is more a technical term, meaning that we mature the cells very long, making a production time of more than 7 days. There's other groups make it apparently 3 to 5 days also, but we, to be on the very safe side of having a very safe product, we make a very long maturation period. So that's the reason why it's Lennox. We've published several studies so far in the palliative situation of cancer. What means palliative? Palliative means the cancer cannot be resected anymore, meaning the cancer is still in the patient. And there we'll be able to show that we can nearly double the survival times of the patients. These results from us was confirmed by many other groups in the world, that they also find the same results. What is now special on our group, we also investigated in the adjuvant situation. What is adjuvant? Adjuvant means the tumor is resected, but we know even if we resect the tumor in cancer that there is a great chance that the tumor comes back in form of metastasis. And this one, we published now a study where we were able to show in rectal cancer, for example, we can reduce this risk of recurrence of the cancer from 50% down to 9%, which is tremendously. Meaning, the better the patient is, the more we have the chance to cure, because we can work with the immune system. What is this therapy? It is very easy. It is in vaccination. It's like a vaccination, but outside the body. For some reason, in cancer patients, the immune system cannot detect the cancer cells. We bring both outside the body by taking blood from the patient, make the immunization in our highly specialized laboratories, and bring the information back into the patient, which means we help the body to detect the cancer cells. And if you say it in military terms, we're not providing soldiers, we are providing officers. And that's the reason why this system works so well, because these dendritic cells go into the body, into the lymph nodes, and train the killer cells. These killer cells, these are the soldiers. So we provide the officers who bring the information into the body, and then the body itself, meaning the immune system of the patient, is capable to destroy the cancer cells.
Okay, the third question is that I want to ask Dr. Frank about, describe about the whole treatment, how long does the treatment take, and what should we care about after we use this kind of vaccines?
Since the production of dendritic cells is restricted by the drug law, meaning when we produce dendritic cells, it is like an individual preparation of a drug for the patient. So we have to take care of a lot of things. For example, we must check in the patients, do they have a viral infection like hepatitis, like HIV, these things. We have to check about some specific chronic infections. This is the first step which is done in the patient before we take the blood. Then the treatment starts. The treatment means at day 0, we take 200 milliliters blood from the patient. Out of this, the dendritic cells are produced over a period of 7 days. At day 7, the cells are injected back into the patient at this site where we have the most lymph vessels. It's not like everybody expects, like giving an infusion back into a vein. No, it's given back into the skin. Why? Because in the skin we have the most lymph vessels, that our dendritic cells can walk into the lymph nodes. So the whole treatment, the duration between taking the blood and giving the cells back is 7 days. The other question was, how often do we have to do this? We have a very big advantage if you compare it with a normal drug. Why? Because these dendritic cells are viable cells. They go into the lymph nodes and they produce or train these killer cells. So we do not have to do it every week or every 2 weeks or every 3 weeks. No, in the adjuvant situation, we do it once. In the palliative situation, when the patient has still tumor, we repeat it. Every half year it is repeated until the tumor is gone. Another very interesting part which you ask is, what about the preventive situation? You know, can we prevent with this dendritic cell therapy patients from getting cancer? If we have a look what the reasons are for getting cancer, there we have a lot of hints that chronic infections, we know this from HPV, for example, human papillomavirus, making cervical cancer, or other cancers. Of course, we can also have an immunization process against these viral or bacterial or parasitic infections. From this point of view, it makes a lot of sense to say, yes, with these dendritic cells we can prevent from cancers. But one thing, as a serious researcher, I have to say is this therapy is now 20 years old. If I want to have reliable results on this, I must treat thousands of patients, and then I can tell you in another 20 years whether you can prevent cancer with this. From the idea, of course, but there we need much more time to prove this.
And the final question, I want to ask a little more general. Yeah, so we all know, we all heard about the landing as part of the very leading position in medical industry. So maybe Dr. Frank can talk a little bit more. What's the advantage in perfections, compare with other medicines or compare with other companies?
This is a good question. Well, I must say, if you compare LAN-XDC production with a normal drug production, it's very difficult. Why? Because if I produce drugs, I have one company, I produce the drugs, I sell them in the pharmacies, and then everything runs in a very well quality. The big challenge for me personally was to bring in a lot of laboratories the same quality everywhere, meaning we underlie the laws of the Chinese FDA, of the American FDA, of the European Medical Agency's laws. We must produce everything according to GMP, meaning good manufacturing practice. And so, together with my friends, especially Professor Yang Lin, we were able to build a network, a worldwide network, which is controlled over a special company, the GMG, Macedo, that we have absolutely sure that everywhere, from the storage control over the production up to the final product, we have the same quality. And this was, even for a German, a really big challenge to get this quality everywhere in every laboratory in the world in the same. The other advantage we have is we collect the data. Every patient is, from this network, is analyzed, collected, and we know the results from this. So we have an overview about a really big number of patients where we can draw out the results then for our therapies, about our success rates, and also if there would be some, also about the side effects. Fortunately, this therapy so far had no serious side effects in thousands of patients.
Thank you.
Happy?
Thank you. Yeah, finished.
I was good looking?
Okay.